Hello, you are welcome to this session. I always remain Wilson, your presenter. Um, Today we shall be discussing the dispensing of medicines and the calculations, or the calculations involved in the dispensing of medicine. So, what is dispensing? Dispensing is a process of preparing and giving medication to a patient based on the prescription. We saw earlier who can prescribe. There are doctors, physicians, clinical officers, and very many other people. And dispensing ensures that the patient receives the correct medication in the correct dose, involving strength, dosage form, and with the right instructions. Because after when you're issuing medicines to patients, you have to issue medicines with clear instructions. So the dispensing process is key. However, while dispensing, it is important to you have to have soft skills as a pharmacy profession or as any health professional. Soft skills are key. For example, me, I said with receive. No. When you are interacting with patients, greet the patients and welcome the patients and greet them. That is key. They will feel loved and they will feel welcome to the premise. So now the dispensing process, receive and validate the prescription. Validation involves checking if it contains the components of the prescription. Remember, we talked about the prescription earlier. And you have to, the next step is to understand and interpret the prescription. Here, you interpret the abbreviations and any information which has been put on the prescription. You need to calculate the cost and then inform the patient. This one is key in a private setting. Calculating the cost of the medicines and informing the patient, because you have to first inform me of the cost of the prescription before you go ahead and prepare the drugs. Because if you just prepare them without my consent, what if I don't have the money? So it is important you first calculate the cost and inform the patient. It is the patient to give you a go ahead to prepare. Now the next step is prepare and the medicines, and then of course label them to dispense to the patient. It is good to always make a final check. If you made a mistake, you can correct yourself. And then after that, you issue the medicine with the clear instructions and also receive money. Then you record the action taken. However, in the government setup, for example, in a government setup here in Uganda, all drugs in the pharmacies and hospitals are free of charge. So there is no calculating the cost and there is no receiving any money for any medication. This is a process of dispensing, of drugs in a pharmacy, in a community pharmacy or in a private setup, medical centers, and in any other place. However, note, while dispensing, it is important to keep the prescription before you, as it serves as a constant reminder of the name and the strength of the medication. Yes, you have to keep it before you. Ensure the medicines you are picking from the shelf is are of the right name and brand, strength and right dosage form. This one is key. Ensure that the medicines you are picking on the shelves are of the right name, brand, and right strength and right dosage form. In a pharmacy, there are different strength of medicines. You have single strength, double strength, and different brands. So ensure that you're picking the correct medication. Uh, Ensure that you are aware of the demographics of the patient, especially the age and weight, because this will help you to validate and also ensure the patient is receiving the correct dose of the medication. However, there are some errors which can occur, like on the abbreviations, the name of the drug, the strength could be an error. The dosage form, we could have an underdose or overdose. The instructions for the patients, drug interactions. Now, most of these ones you'll get them as you progress in pharmacy, because if you haven't yet done pharmacology, for example, there's no way you will know the drug interactions, the doses, if this is therapeutics or medicine, and then this over. But however, with time, you'll get to know all these things. Now, in case of any errors, it is important to politely inquire from the prescribing physician. Don't show any superiority that for you know better than the other. No, inquire politely. This is what I know. You have to use soft skills, as we have agreed that said that soft skills are key for any pharmacy professional. In case of any errors, this is not the point. In case of any errors, it is important you inquire from the prescribing physician or doctor to rectify the error. Rectify the error. So that, and then of course there are very many errors which you'll always find out. The biggest one is the handwriting. I don't know, some people write like they're going somewhere. So you have to be important. You have to know different handwritings of maybe physicians. And in the case of you understand the handwriting, inquire from them. Now, how do we calculate the quantity of medicine to dispense? Or how do we calculate the amount of drugs or the number of tablets, capsules, or bottles to dispense? We have formulas which we shall use, and this will enable, if you know this calculation, they will enable us to calculate the number of capsules, tablets, and other dosage forms required to fill the prescription, and again to tailor it to the money. Now, as you are beginning this profession, if you are a beginner, you always need to follow this calculation. But with time, as you become a senior in practice, some of them will be just coming to you. You can just look at a prescription and you already know the amount, the number of dispense, because why? This is what you are dealing in every day, every day, every day. And remember, most of our patients suffer from the same disease condition. So if you receive the same prescription every day, every day, every day, you'll have to know how to calculate them. However, since we are beginning, it is good to follow the calculations. Then later on, you can master them and just look at the prescription and you dispense to patients. So which are those? Calculation? The number of tablets to dispense per dose or capsules. You just need to divide the prescribed dose or the dose prescribed in milligrams divided by the medicine strength available, what you have in stock. You could have 500, the prescription called for 1000 milligrams. Now, number required daily, it is good you multiply the number of tablets which you've calculated above times the frequency or number of times in a day that the patient is supposed to receive the medication. Are they using it 3 times a day, 4 times a day, twice a day? The total required to fill the whole dosage regimen for each medication is the number required for daily dose, which is quoted above, times the number of days. So it is important here, you know how to interpret the times on the prescription. And of course, the cost will be the total required to fill the quantity of drugs for the whole dose times the cost of each tablet or each bottle. However, in cost we have some drugs which are costed per pack. A pack of 24 costing this, a pack of 6 costing this, and while others are costed per each tablet. So ensure you follow all those. Of course, for medical devices, these ones you just need to count them. If you are dispensing 4 syringes, 2 cannulas, they are just 2 cannulas. For combination drugs, this one I will talk about it as you progress. If drugs appear in a combination or 2 of them, it is important that the strength of the active drug are the strength of active drug should be added for calculation purposes only. This will enable you to know how many you have or how many you will dispense. For calculations which have half a tablets, half bottles, half an ampule, always there is a problem here if you get such a calculation. If you have half a capsule, half a bottle, half an ampule, half a vial, there is a problem. Always one, because you can't dispense half. Now your answer should have units. Some of you will calculate, and then for example in class when we are marking you, if you just put 10, what did you mean? 10 what? There should be 10 tablets, 10 capsules, 10 ampules, 10 vials, 10 boxes, 10 bottles. 10 maybe can be for syringes. Those ones may not have units. So that's a brief introduction about the calculation. I have two questions here which we shall go through. For example, I have this one, practice question 1. Methyl dopa is issued to treat hypertension, prescribed to a patient to take 500 milligrams only for 3 weeks. In stock, you have 250 milligrams tablets, each costing 400 shillings. Now, for us right now, the goal is to understand this prescription here. Because you may not know what methyl dopa is doing at this level. However, as you progress, the way they teach you pharmacology, you'll get to know. So the goal is to dispense this medication, and if this medication you can dispense it, since we have taught you how to interpret the prescription. The question is, how many tablets will you dispense and the total cost? Always you have to know the dose prescribed and the strength you have for a tablet in stock. So the number of tablets required for each dose, as we saw the formula earlier, is the dose prescribed in the prescription divided by the strength of the tablet you have in stock. This one here. So here I get 2 tablets. Yes, the dose is this and the strength you have is that. Number of tablets you have to talk about the daily, taken daily. This one is taking it all. Interpret what all they mean. This is once daily. So number of tablets is this 2 times the ones times 1, giving you 2 tablets. However, it's taking the drug for 3 weeks. Duration of therapy is 3 weeks, which is equivalent to 21 days. If you know the number of tablets is taking daily and the total duration of the prescription, to get the total number of tablets to dispense, you just need to multiply the duration and the number which is being used daily. Here you're going to get 42 tablets. Ensure that you have units. Don't just put 42. If you just put 42, shall cross you. What is 42? Are they capsules? Are they bottles? Are they strips? Are they boxes? So ensure you give us the exact. These units can be gotten from the strength you have in stock. So the total cost, one tablet costs this one about 42. This is a simple calculation. This is what you first inform the patient before you go on and pack, because the patient can tell you, I don't have this money, can just give me for 1 week, I'll come back after 1 week. So this is practice question. This is not 3. Practice question 2. I receive a prescription, the following prescription of artemether 80 milligrams for 80 milligrams BD, for 3 days. Paracetamol tablet 1 gram TDS for 3 days. In stock you have artemether tablet 20 per 120 milligrams, pack of 24 costing. This here they are showing that looking at the whole pack costs 5,000, and paracetamol 500 milligrams tablet costing 20 shillings. They say dispense the prescription and determine the cost. So I gave us this note that for combination drug it is important you first add the strength of the actives in the drug for easier calculation. So the prescribed dose, it is 80 plus this, giving him 560. But at method by function, this is strength available. I just copied and pasted. The strength available is 20 and 120, giving me this 140 milligrams. So the number of tablets for each dose is just the dose, prescribed dose, which is 560 divided by 140, giving me 4 tablets. Daily tablets is taking it twice, so it's taking it 2 times a day. So total number of tablets is just 4, which is for each dose times the frequency in a day, giving me 8 tablets. Duration is for 3 days. 2 tablets, you just need to multiply the 8 giving per day times the number of days, giving 24 tablets. Now remember here we were given the whole pack of 24 costing 5,000. So 24 tablets, 24 tabs cost 5,000. For paracetamol, the dose was 1 gram, which is equivalent to 1,000 milligrams, and the strength is 500 milligrams. So the number of tablets is just 1,000 divided by 500 milligrams. So you can easily convert this ones to gram depending on the conversion, because we did a session on the systems of measurement, and then you know all these. Daily tablets, the frequency in a day is TDS, 3 times a day. So just 3 times 2, giving me 6 tablets. Duration is 3 days. Total number of tablets, just tablets per day times the number of days, giving me 18 tablets. The cost, each one is 200 shillings. So which is equivalent to 18 times 200, giving me 3,600. So the total cost of the whole prescription is 8,600 shillings. This is what you have to inform the patient. This has been a short presentation. We have more questions on our Google Classroom, and always try to attempt them, because they'll improve your dispensing skills, and they will improve on very many scenarios that you will engage, that you will find in pharmacies, and you'll be a better pharmacy professional. I always remain Wilson. Thank you.